Hi, it's Dr. Tucker here, and today I want to talk about how the spine relates to organ issues. So, in the 1920s, there was a medical doctor, Dr. Windsor, who did cadaver studies. And what he essentially looked at was when you open up cadavers, tracing the nerves to the organ. And that's where we come up with a spinal nerve chart. So, what they found during the study was that if there was nerve supply going to an organ, let's say your lungs or your stomach, and the joint where the nerve left was healthy, meaning there was no arthritis, no disc issues, the nerve was not impinged, that organ was relatively healthy. Now, on the flip side, if there was some sort of curvature in the spine, or if there was some sort of bone spur that might have been pressing on the nerve, all of a sudden, that particular tissue that was receiving that nerve supply was diseased. So somebody would have some kind of pathology at that organ. So some of the specific levels that we have to look at are going to be the thoracic areas as an example. So T6 controls, the stomach region. So if somebody had, a history of indigestion in their life, right? Acid reflux, they might have a stomach issue. This was a study that came out of the 20s. Or if somebody has a bulging disc at, the lumbar spine, and let's say it's at the L1-2 area, and there's some sort of impingement, that particular patient might have intestinal issues. So during his life, he might be battling with things like constipation, he might be battling with things like loose bowels, but at the end of the day, pathology starts to build. Cancers, diverticulitis, colitis. So the spine itself can have a massive impact on your organs. It's not just a matter of what you eat. That's a chemical perspective. But this particular study pretty much proved how the autonomic nervous system and the organs work for chiropractic, and that was almost 100 years ago. Hope this keeps help.